There is a small, slightly embarrassing moment that almost everyone has experienced at least once. You wake up in the morning, turn your head on the pillow, and there it is. A damp spot. A little wet patch on the pillowcase. Perhaps you have even noticed it happening to someone you love, and quietly wondered what could possibly be causing it. If you are past the age of 60, this may have started happening more often than you would like to admit. You may have noticed dampness at the corner of your mouth in the morning. You may have found yourself wiping your chin before anyone else in the house wakes up, or perhaps you have simply been waking up with a dry, scratchy throat, a stiff jaw, or that strange, sticky feeling around your lips that tells you something happened overnight that you were not aware of. These are not signs that something is wrong with you as a person. They are not character flaws, and they are certainly not reasons to feel shame, but they are signs. They are quiet messages your body is sending from places you cannot see, places you cannot feel while you sleep, and they often have very specific meanings that are well worth understanding. Before we go further, take a moment and think about what your mornings have actually looked like over the past few weeks. Have you noticed a dry mouth? A wet pillow? A cough that seems to come out of nowhere in the middle of the night? A sore throat that has no clear explanation in the morning? A tired feeling in your jaw, as if you have been clenching for hours? If any of these sound familiar, then I want you to listen carefully. Because the truth is, drooling during sleep after 60 is rarely random. It usually has a cause. And in most cases, that cause can be identified, understood, and gently supported. If you found this video helpful, please give it a thumbs up, subscribe to the channel, and turn on the notification bell so you never miss our latest health tips. We share trusted, easy-to-understand health information to help you stay active, informed, and independent. If you'd like, I can also make it more emotional, more engaging, or optimized for higher YouTube retention. Many people assume that drooling while sleeping is simply a natural quirk of getting older, the way some people snore or the way some people toss and turn in the night. And in fairness, occasional light drooling does happen to almost everyone at some point. But when it becomes a regular pattern, when it leaves noticeable wetness night after night, when it begins to interrupt your sleep, your throat comfort, or even your confidence, it deserves closer attention. Your body is communicating with you, and the message is far more specific than you might expect. The sooner you understand what it is saying, the sooner you can respond with calm, sensible steps instead of worry. I want to begin with a short biology lesson, not the textbook kind, just a simple picture that will help everything else make sense. Think of your mouth as a small, busy harbor. Saliva is constantly being produced. Your salivary glands work around the clock, producing roughly half a liter to 1 full liter of saliva every single day. That saliva is not a problem. It is essential. It helps you chew, swallow, taste, digest, and protect your teeth from harmful bacteria. Now, the important part. While you are awake, you swallow automatically, dozens of times an hour without even thinking about it. Each swallow sends that fresh saliva safely down into your stomach. The harbor stays tidy, nothing spills out. But the moment you fall asleep, the system shifts. Your swallowing frequency drops sharply. Your jaw muscles relax. The muscles around your mouth relax. The muscles at the back of your throat relax. And your body begins to operate at a much quieter, much more passive level. This is normal. Sleep is supposed to bring rest. It is supposed to bring recovery. It is supposed to bring a calm, almost peaceful slowing of voluntary control. The problem appears when that relaxation goes slightly too far, when the lips do not fully close, when the jaw drops a little open, when the head tilts just enough to let gravity do its work on the saliva that has been quietly collecting in your mouth. That is when you wake up with a damp pillow and wonder what happened. After 60, several things tend to make this whole picture more complicated. None of them are reasons to panic. Each of them has a clear, logical explanation once you slow down and look at it. First, the muscles around the mouth and throat naturally lose some of their tone over time. The orbicularis oris muscle, the ring-shaped muscle that helps your lips close firmly, becomes a little weaker. So do the muscles that lift the soft palate. So do the small muscles that participate in the automatic swallow. This change is gentle, gradual, and easy to miss until you start noticing its small, everyday consequences. Second, many older adults breathe through the mouth during sleep, sometimes without realizing it. This may be due to nasal congestion, allergies, a deviated septum, age-related changes in nasal tissues, or simply the way the jaw relaxes once sleep sets in. The breathing changes can be so quiet that you never hear yourself do it. Third, the production of certain neurotransmitters, the chemical messengers that coordinate swallowing, can change over time. The reflex that says swallow now can become slightly slower, slightly less reliable. Put these things together, and you have a perfect setup for saliva escaping the mouth during the long hours of the night. What you are seeing on the pillow is not a failure, it is a small signal. And once you understand where the signal is coming from, you can respond to it with patience rather than worry. Now, I would like to walk you through 7 of the most common reasons this happens, ranked from the most familiar to the one most people never even consider. As we go through them, I want you to notice which ones seem to fit your own experience. Because sometimes the body is sending you a clear signal, and you just need the right language to understand what it is trying to say. Before I reveal the first one, I would love to know where you are watching from and what your mornings have actually looked like. Have you noticed a damp pillow, a dry mouth, a sore throat, a morning cough? Tell me your city and a short note in the comments. I do read them, and your experiences help connect this information to real life. Let us begin. The reason number 7 is simply your sleep position. Most people do not realize how much their sleep position influences whether saliva stays in the mouth or ends up on the pillow. When you sleep on your back, gravity pulls saliva toward the back of your throat. Your body usually swallows it reflexively, even in sleep. But when you sleep on your side, or even more commonly on your stomach with your head turned sharply to one side, the picture changes. In these positions, your mouth tends to fall slightly open, your lower jaw drops, the angle of your head changes, and gravity, that quiet, constant force, begins pulling saliva in a different direction, not down your throat. Instead, forward, out through the slight opening of your lips, across your cheek, onto your pillow. This is one of the most overlooked explanations for nighttime drooling. People sometimes assume it points to a deeper problem, when in many cases, the answer is as simple as the way the head rests on the pillow at 2 a.m. If you tend to drool on a particular side of the pillow frequently, that side usually tells the story. It is the side your head is tilted toward during the deeper cycles of sleep. A small experiment worth trying. For 1 week, intentionally sleep on your back with a thin pillow supporting your neck. Many people find that the dampness on the pillow drops noticeably during that week. Not always, but often enough to confirm that position was a meaningful contributor. The reason number 6 is mouth breathing during sleep. Breathing through the mouth is one of the clearest pathways to drooling after 60. When you breathe through your nose, your lips rest together naturally. The mouth stays closed. The seal holds the saliva inside where it belongs. But when you breathe through your mouth, 2 things happen at the same time. Your lips part
Aging
to allow
is a
air
complex
in, and the
biological
air movement
process.
gently
It
dries
affects
out
every
the
cell and
tissues
organ
inside your
system in the
mouth,
body.
which can
Tissues
actually
lose their
stimulate
elasticity
even
over
more
time.
saliva production in some people. That is a frustrating combination. More saliva with less ability to contain it. Many older adults breathe through the mouth at night because of nasal congestion that has built up over the years. Allergies, dust sensitivity, a deviated septum that was never treated, chronic sinus inflammation, or simply the natural settling of soft tissues in the airway that can happen with age. The pattern is usually consistent. If you wake up feeling stuffy, if your lips feel dry even though you have been drooling, if your throat has that scratchy morning burn, mouth breathing is a very likely contributor. The dry lips come from the air moving across them, the drool comes from the open mouth. Those 2 things can absolutely happen at the same time, and it confuses many people who cannot understand why they would drool when their mouth felt so dry. The reason number 5 is something that many people do not associate with drooling at all, but it is one of the most common, and it is called gastroesophageal reflux, often shortened to GERD. Here is what happens. During the night, stomach acid can travel upward into the esophagus. This is especially common when you lie flat, when you eat late, or when the valve between the stomach and the esophagus has become a little weaker with age. When the body senses that acid is creeping upward, it responds with a protective reflex. It increases saliva production. There is a reason for this. Saliva is slightly alkaline. It helps neutralize acid, so when acid threatens the lining of the throat, The body essentially sends saliva to the rescue. That is a wonderful defense, but it has a side effect. The extra saliva builds up in the mouth during sleep, when swallowing has slowed down. And without the usual number of swallows to clear it, the mouth can quickly become too full. That overflow becomes drooling. Researchers studying the link between reflux and nighttime symptoms have repeatedly found that acid exposure during sleep tends to be longer and more intense than during the day, partly because people are lying flat and partly because the reflexes that normally clear acid are quieter during deep sleep. If you also notice a sour taste in the morning, a burning sensation in the chest during the night, or a cough that seems to appear out of nowhere when you lie down, reflux is worth paying attention to. A small change worth considering is keeping the evening meal a little earlier in the day when possible and avoiding heavy or spicy foods right before bed. Even modest adjustments to the timing of dinner can sometimes lead to noticeably calmer mornings. The reason number 4 is sleep apnea, an issue that has gained a great deal of attention in recent years. Sleep apnea is far more common in adults over 60 than many people realize. During an apnea event, the airway becomes partially blocked. Breathing becomes labored or briefly interrupted. The body responds by opening the mouth wider, working harder to pull in air, and shifting into mouth breathing, often for a long stretch. While this is happening, saliva is being produced normally, but it is not being cleared at the usual rate. The mouth is open, often widely. The jaw may drop lower than usual. Saliva begins to pool, and the natural drainage pattern of the throat changes. Many people who have sleep apnea wake up with a damp pillow, a dry mouth, a sore throat, or a feeling of fatigue even after a full night in bed. The drooling is often the most visible clue of something much more important happening underneath. The combination is striking. Loud snoring, gasping for air, a wet pillow, a dry mouth, morning fatigue that does not match the hours spent in bed. When these appear together, they paint a clear picture that researchers and sleep specialists have been describing for many years. This is not a diagnosis. It is simply a pattern that has been documented in clinical literature again and again. If you snore loudly, wake up gasping, or feel unusually tired during the day despite sleeping through the night, this is worth raising with your doctor. The reason number 3 is one of the most quietly common among older adults, and it is often missed. It is age-related weakening of the swallowing reflex. When you are awake and alert, you swallow approximately once every minute or two without even noticing. Your brain coordinates this automatically, but during sleep, swallowing slows down to a much lower frequency. And as the years go by, that automatic coordination can become a little less responsive. In younger adults, even during sleep, the body usually swallows often enough to keep the mouth reasonably clear. But in older adults, the intervals between swallows can stretch longer. The message that says now is the time to swallow can become slower or weaker. When that happens, saliva builds up gradually. The mouth fills, the lips relax, gravity takes over. Drooling appears, even though nothing is fundamentally wrong. The whole system is just a little less responsive than it used to be. This gentle slowing of automatic functions is one of the reasons many clinicians describe nighttime drooling as a marker of subtle, age-related changes in neuromuscular response. It is not a crisis. It is not a breakdown. It is simply the body running at a slightly quieter pace than it did in earlier decades. The reason number 2 is dental and oral changes. Many adults over 60 wear dentures or partial plates. Many have missing teeth. Many have shifting bites from years of grinding or gradual jaw changes. Each of these situations can change the way the lips come together, the way the jaw rests during sleep, and the way the tongue behaves when the body is fully relaxed. A denture that fits slightly differently, a missing molar that leaves a small gap, or a bite that has shifted over time can all contribute to an imperfect seal around the lips during sleep. And a small, imperfect seal is all it takes for saliva to find its way out. Many older adults also experience reduced saliva quality, not just reduced quantity. The saliva becomes thinner or its composition changes, which can make it flow more easily and escape more readily. Even small changes in how the teeth meet, how the dentures sit, or how the jaw rests at night can quietly open the door to drooling that was not happening a few years earlier. A routine dental checkup, especially if you wear dentures, can sometimes reveal that a simple reline or adjustment is all that is needed to restore a more secure overnight seal. And finally, we come to number one, the reason that catches many people by surprise. It is the side effects of medications. This is the factor that very few people think of first, but it is one of the most common contributors to nighttime drooling in adults over 60. Many medications, including some prescribed for blood pressure, depression, anxiety, sleep, allergies, nausea, and pain, can subtly affect the way the salivary glands work or the way the swallowing muscles coordinate. Some medications increase saliva production as a side effect. Some relax the muscles that keep the mouth closed. Some change the activity of neurotransmitters involved in the automatic swallow. There is a body of research that has documented this pattern, particularly with certain antipsychotic medications, cholinergic agents used for memory support, and some medications used for conditions like Parkinson's disease. But the same pattern can appear more gently with many commonly prescribed drugs in older adults. If you have started a new medication in the past several months and you have noticed an increase in drooling, morning dampness, or that sense of waking up with a full mouth, this connection is worth considering. I want to be very clear. I am not diagnosing anything. I am not telling you to stop a medication or to adjust a dose. I am simply pointing out a relationship that exists and that is worth discussing with the prescribing physician, because small adjustments sometimes make a noticeable difference in sleep comfort. What surprises many people is how often the answer turns out to be much simpler than expected. A medication review, a slight change in the timing of a dose, a different formulation. These small conversations can sometimes reduce nighttime drooling dramatically without adding anything new to your routine. Now that we have walked through the 7 most common reasons, I want to share something that may help across most of them. A simple evening routine that supports a calmer, drier mouth through the night. It is built around 3 gentle steps. First, clear the nasal passages before bed. A saline rinse, a warm steam inhalation, or simply a few minutes with the head over a bowl of warm water can soften congestion and make nasal breathing more natural during sleep. The goal is not a medical treatment. The goal is simply giving the body a clearer path for air to move through the nose rather than the mouth. Second, slightly elevate the head of the bed, not by stacking pillows in a way that bends the neck sharply, instead by placing a small wedge under the mattress or gently raising the head of the bed frame. This small change uses gravity to support drainage and reduce the pooling of saliva in the throat. Third, practice a brief, very simple swallowing exercise before sleep. Just a few slow, deliberate swallows, with the lips gently closed and the tongue pressing lightly against the roof of the mouth. This helps reinforce the neural pathway that supports the automatic swallow, reminding the muscles of the pattern they will follow through the night. These 3 steps do not require any equipment. They do not require any medication. They simply encourage the body to do what it is naturally designed to do with a little more ease. Many people who have tried these simple habits have reported feeling more comfortable in the morning, a drier pillow, a less scratchy throat, a sense that the night felt calmer in some way they cannot quite describe, but that mattered. Before I close, let me share 3 mistakes that often undo the good work people are trying to do. The first mistake is ignoring persistent drooling, assuming it will pass with time. Occasional dampness is one thing. Regular drooling, especially when it is paired with snoring, choking sensations, or morning fatigue, deserves attention, not dismissal. The second mistake is mouth taping without medical guidance. Some online sources encourage taping the lips closed at night. This can be helpful for some people, but it can also be risky for those with nasal obstruction or undiagnosed sleep apnea. Never use this technique without first understanding your breathing patterns. The third mistake is staying silent in the doctor's office. Many adults feel embarrassed describing drooling during sleep. They worry it sounds childish or strange. But the truth is, this is a meaningful clue, and it is the kind of information that helps a physician see the full picture of your health. Now, one final point that is very important. If your drooling is sudden, severe, one-sided, or accompanied by slurred speech, facial weakness, difficulty swallowing liquids, sudden choking, or unexplained weight loss, please seek medical attention promptly. These can occasionally point to more serious conditions that need timely evaluation. If this information has been genuinely helpful, please give the video a thumbs up. It only takes a moment, and it helps this message reach others who may be quietly going through the same experience without understanding why. And let me know in the comments which of these 7 reasons felt most familiar to you and what your mornings have actually looked like. Take good care of your sleep. It is one of the most powerful tools you have for protecting your health, your energy, and your clarity as the years go on. And sometimes, the smallest signals your body sends you at night are the ones most worth listening to.